Wisp Sports Radio, the voice of women in sport.
Hello, thank you for downloading this podcast and welcome to Active Health. I'm Dr. Juliet McGrattan, and this show is about the health niggles and issues that can affect you when you exercise or even prevent you from doing it altogether. I'll be giving you tips and advice on how to overcome these issues from my experiences as a doctor and as a runner. In this episode, I'll be talking about the topic of runny noses during exercise. You know, you're finally out of the door for your walk or your run, you're jumping around in your gym class, bouncing your ball on the netball court, and before you know it, you're searching around for a tissue. It's so frustrating. Why does exercise make your nose run? And how can you stop that exercise-related runny nose? Is there any treatment for it? Why does it happen? It's so confusing. Well, the medical term for this annoying drippy nose is rhinitis. It comes from the Greek word rhin or rhine, which means nose, and itis, which means inflammation. Along with a runny nose, with rhinitis, you might get some sneezing and watery, itchy eyes. And there are lots of different causes of rhinitis. The most common are allergic rhinitis. So we're talking about hay fever and pet allergies here. The other common one is infective rhinitis. That's also known as the common cold. But rhinitis can also be triggered by irritants. So irritants such as house dust and chlorine in pool water are two good examples which certainly drive my nose insane. Cold air can be a trigger too, so exercising outdoors, particularly in winter, often causes a runny nose. But sometimes the cause is actually purely the exercise itself, and this is true exercise-induced rhinitis. It doesn't matter if you're inside in a gym or outside, in warm air or cold air, exercise just seems to trigger your nose to run. Exercise-induced rhinitis, and it's common, especially in people who have nasal allergies. You know, our body's a pretty clever thing, and it produces more mucus as a great way to trap dirt, dust and germs that we might breathe in when we start breathing more heavily during exercise. It's one of our body's defense mechanisms. So by increasing the mucus production, it's just simply trying to keep us healthy. Secondly, when we exercise, our body tries to get as much air in as possible to give us maximum oxygen intake to fuel our muscles. And one of the ways it does this is to open up the nasal passages to increase airflow. But of course, unfortunately, by doing this, it means there's an increased exposure to nasal irritants, and that's bad for you if you suffer from nasal allergies. So the nose is running. What can we do to try and stop it? First, most important thing to do is to spot the trigger. Can you work out what it is that's triggering your runny nose so you can help to reduce your symptoms? Is it allergy related? If it's seasonal and related to pollen, so hay fever, then you need to reduce the contact with the allergen. So covering your nose and mouth with a light scarf, wearing wraparound sunglasses to keep the pollen out of your eyes, showering as soon as you get in, washing your running kit, that can help. It may be actually that if the pollen count is particularly high that you actually choose to exercise indoors on that day. If cold air seems to be your trigger, then simply warming up the air before you breathe it in can help. So again, like a buff type neck scarf that you simply pull up to cover your nose and mouth. That way the air will be warmed before it goes into your nasal passages, and that can stop or reduce the runny nose sometimes. You can also use that trick if you find polluted air irritates your nose. So it might be that you do that, or it might be that you choose to exercise away from the busy roads, or at least avoiding rush hour. Chlorine, as I said, that can be a trigger, certainly is for me. I struggle with sneezing and a runny nose for hours after I've been swimming, even if I've rinsed off well in the shower, so much so that it actually puts me off going in the first place. But many pools now use ozone and other techniques to sanitise their water and reduce the amount of chlorine that they use. And I've certainly noticed that when I was a child, there was a lot more chlorine in the water than there is now. So I am actually able to swim, but it's still not a good exercise for my nose. And here's a tip, okay? You can get some treatments that will help this, and the best place to go is to see your pharmacist. You know, if you've looked at your triggers, you've tried to reduce your triggers, your symptoms are still there, go and have a chat with your pharmacist and find out what's available over the counter that you can use. There are medications to ease rhinitis. They might include an antihistamine nasal spray that you can squirt up your nose, or a steroid nasal spray, or possibly even antihistamine tablets. And those are good if the cause is allergic. And most treatments for this are available without a prescription. So your pharmacist can help you work out which is going to be the best one for you. They can also find out about any other medical problems you have or any other medications that you're on that might interact with what you're wanting to take for your rhinitis. So do have a chat with them. They're a really great resource and you can get some really, really good advice from them. Finally, stock up on tissues because this is tricky to resolve. Sometimes, despite the avoidance of triggers, despite the medication, sometimes we just have to accept that that is how it is and we have to work around it. Now, you might not know, but some sports where you have to wear gloves or you can wear gloves, so for example, skiing, cycling, running, some makes of gloves actually have little absorbable toweling pads sewn into them exactly for this purpose, so you can wipe your nose when you're enjoying your skiing or enjoying your run. Stick some tissues in your gym bag, in your running belt, shove them up your sleeve. There is always the snot rocket. I don't like it. I don't know how people manage to make their snot travel quite as far as they do. But if you're going to use that, please do check that there is nobody close behind you. That is not what you want when you're trying to enjoy your run. One little word of advice or warning, if you like. If you seem to have persistent rhinitis and it's not exercise related, then please see a doctor for advice, particularly if the nasal discharge is thick, is blood-stained, is from one nostril, if it's got an offensive smell, or it just doesn't seem to be easing up, then please do see a health professional regarding this. Okay, so I hope all of that is helpful. Just some simple topics and tips just to try and help you overcome those annoying runny nose.
Hi, I'm Nicole Drought. I'm an Irish racing driver and a proud WISP ambassador. I support WISP because they help to increase visibility in women's sport. This is quite important because it'll help to encourage girls into sport if they have role models to look up to. You can follow me on Facebook, Twitter and Instagram at Nicole Drought Racing. Thanks for listening and supporting WISP.
I would love to hear your tips as well, because I know there are lots of you out there who suffer with this condition. So please comment and follow on social media at WISP Sports, or me personally at Juliet McGrattan on Twitter and Instagram, and at Dr. Juliet McGrattan on Facebook. You can also email at info@wispsports.com. This is the final episode in this first season of Active Health, and I have enjoyed it very much. I've really taken great pleasure in chatting to you, giving you these tips and advice, and I want to say thank you very much for listening and for supporting women in sport everywhere.